Hi, I'm Rachel Bristol, Executive Director and CEO at Oregon Food Bank. A lot of people ask me, why is Oregon Food Bank involved in public policy discussions about health care? I tell them because health care and hunger are directly linked. Each day, thousands of Oregonians are forced to make impossible choices. Do they buy food for their families, or do they take their daughter to see a doctor? Do they buy fresh fruit and vegetables, or pay for their medicine? Over the next few minutes, thanks to a generous grant from the Northwest Health Foundation, you will hear from some of these struggling families that have turned to the Oregon Food Bank Network for help. For these families, health care can't wait.
Chuck and Cynthia Graham live in Clatskanie. Chuck is a cook at a local restaurant and receives health coverage through his employer. But each month, they pay hundreds of dollars so that Cynthia can also receive care.
We live literally from paycheck to paycheck. You know, normally, I don't get paid till Thursday, and we're out of money now.
It's $350 a month just for me, and that's a lot out of a paycheck. A lot of people around here, it's either eat or get health care, you know, because you only have so much money, and one's got to give.
Chuck and Cynthia worry about their ability to afford these extra payments, a situation shared by many in their community and throughout the state.
Where we live at, most everybody are working people.
Or on Social Security retirement.
Yeah, but a lot of them are just low-income people who are busting their butts, trying to make it from day to day, pay their rent or their house payment, and keep groceries on the table for, you know, and healthcare is not an option.
Keeping kids healthy is a top priority for parents, and yet 1 out of 4 children eating from an emergency food box do not have any health coverage. It is especially difficult for families when poor health affects a parent's ability to work. Many adults struggle daily because they cannot afford the medicine they need. Roger Luna from Troutdale is one such person. Roger is uninsured and has diabetes. Unlike Roger, his 3 daughters are covered under the Oregon Health Plan.
I've worked all my life since I've been 13 years old. I'm 44 years old this April. In the last 3 years, my health has deteriorated rapidly due to this diabetes, and I can't get a grip on it because I can't get somebody to help me with medication. It's like if I have it, I'm productive. I can work, I feel good, you know, and when I can do that, I can go, you know, provide for my family like, you know, I should.
The Oregon Health Plan provides meaningful security for Roger in knowing that his girls, for now, have their health care needs met.
And I believe once you get in with the Oregon Health Plan, you have a good doctor. They're able to take care of you. You're able to work. You're able to do whatever you need to do to be a family in a unit. And that's important to me.
Like nearly 60% of emergency food box recipients, Jean Frost of Portland delayed getting medical care because of cost. She worked hard to support her 2 daughters. Jean only had health insurance on and off for a total of 5 years. Because Jean did not have consistent health care coverage, her health problem went untreated. Her health worsened. She was forced to seek emergency care. Jean was left in a state of poor health and was burdened by medical debt for years.
At one point got so ill that I felt like I was going to die, so I went to an emergency room because it was the only place I could go. There was nothing else I could do. If I would have, say, had medical coverage and gotten proper medical care within the preceding 5 years of my illness, maybe none of this would have occurred. Maybe I would still have good jobs because I wouldn't have gotten so ill that I had to quit my job, or that I got so ill that I just couldn't perform well on my job.
The difficulties of affording medical care are shared by thousands of families throughout Oregon. Oregon Food Bank's statewide network provides emergency food to an average of 200,000 people each month. Of these clients, 41% do not have health insurance.
It's just a stress. It's one that's always there. You don't have insurance. You just come home every day and hope everything's okay. But you always think about it because you don't feel good. I didn't feel good as a business owner working to try to keep things going that I wasn't covering my kids during certain times.
Jimmy Harden of North Portland struggled to afford health coverage for himself and his family during his years as a small business owner. As a father of 3 sons, Jimmy has worked hard to put his family first.
because anything can happen at any time, especially with 3 boys. They're all playing sports. You know, we love camping and fishing, so a lot of times they're hiking with their friends out in the woods, and they're, you know, jumping in the Clackamas River or way out by Estacada. So you just hold your breath the whole time.
The stories you've just seen are a few examples of the thousands of families throughout Oregon who struggle to afford health care. At Oregon Food Bank, we know that the lack of health care is a major driver of hunger. As our elected officials, you have the opportunity right now to help families find economic stability, better health, and bring Oregon as much as $1 billion or more in federal funds. We encourage you to be bold, to expand access to affordable, quality health care for tens of thousands of Oregonians in need. For these families, health care can't wait.